breast cancer, uterine cancer, pancreatic cancer, many different cancers, because the MTHFR gene is real important in cell division and in DNA repair. So it can speed up cell division and it can fuel and trigger cancers, especially when one is older.
Welcome back to Dr. Colbert's broadcast. This is part 2, and we are joined with my dad, Dr. Colbert, of course, my mom, Mary, and my wife, my lovely wife, Meredith. And today we are talking about MTHF. Now, Dad, I want to review for people that are just catching this show, didn't watch the last one. If you didn't see it, go back to the last show, watch it. But let's review what you talked about on the last program.
Well, first of all, we have a major mutation. Well, I should say there's a mutation called the MTHFR mutation that affects about 50% of the U.S. population. Now, this mutation is in the special gene, the MTHFR gene, that produces the enzyme MTHFR, which is reductase enzyme, which is critical in the production of energy and the production of neurotransmitters and protecting the brain and protecting our circulation. When we have a mutation in the genes, there's 2 genes that we have. See, we have 46 chromosomes, but on the first chromosome, at the position of the C677, the 677th position on that chromosome, the cytosine has been replaced with thymine, which is a nucleotide base. I know it's a lot of gobbledygook, but that's a mutation, meaning the gene doesn't work as good. When you have just one mutation from one parent, that gene is working at about 70%. But when you've inherited the gene, the MTHFR, from each parent, that gene's only working at 30%. At 30%, that enables disease to enter in. And diseases that occur, especially with the MTHFR C677T gene, these are major diseases. These include major depression, they include schizophrenia, bipolar disorder, anxiety, autism, ADHD. So especially if a family member has major depression or if they have schizophrenia, bipolar, I've found so many people with this major mutation, that gene. But also their increased risk of cancers, breast cancer, uterine cancer, pancreatic cancer, many different cancers, because the MTHFR gene is real important in cell division and in DNA repair. So it can speed up cell division and it can fuel and trigger cancers, especially when one is older. And also autoimmune diseases. Almost every autoimmune disease is related to this. And so many people get autoimmune disease at young ages. I developed autoimmune disease in my 20s.
That was psoriasis.
I was covered with psoriasis.
I remember.
And I didn't even figure this out until around 2000 or so. And that happened in 1990. Almost every autoimmune disease is associated, and the major mutation is the worst. But then you have miscarriages and pregnant with. So many women have come to me who've been pregnant or haven't been able to get pregnant, and they've had recurrent. One lady had 10 miscarriages. I checked her MTHFR gene. She had a compound mutation. She had the minor mutation in the MTHFR A1298C and a minor mutation in the C677T, which is as bad as the homozygous or the major mutation. And everyone had missed it.
Meredith mentioned something earlier about a lot of women.
I was remembering when I was pregnant, I was told to take folic acid.
Yes.
I'm just wondering.
And it's really important because, see, folic acid is important to form the neural tube and to prevent spina bifida, to form the brain. So there are birth defects when you don't get enough folic acid. Women pregnant need at least 800 micrograms to 1,000 micrograms, and maybe more depending on what your OB says. But generally, that's what they need because it protects you against having spina bifida and encephaly, where part of your brain and cranium don't form. And these people, they die. They only live.
But if they're getting 400 micrograms of folic acid or 800 micrograms.
I had the gene.
If she had the gene, which half the country does, half the women.
Well, if she has the minor gene, no problema.
No problem. She's okay.
But if she has the major gene, yes, she may need more.
About 1 out of 5 women.
Yeah. So, yeah, 1 out of 5. Yeah, about 8.5 to 10% of women have the major gene for the C677T, and about 8.5 to 10% have the major mutation for the A1298C. So about 20% have the major mutation.
Okay.
So
And
yes,
the way you find out is you do a simple blood test.
it costs about
Well,
$100. You
costs-
can do it online. We'll
And
talk
it's
about it.
important for people to know this. There's a scripture that comes to my mind. It says, "My people are destroyed for lack of knowledge."
Yeah, Hosea 4:6.
So see, a lot of
Amen.
people, they're praying and believing God for this and that. And when in fact, all they need is some knowledge about how they're made up. And then there's natural things they can do to support their system so that it optimizes. It's, you're operating in your tops, and not down in the. That's what I love, is that there's answers.
Well, plus, so many people get tired. This these neurotransmitters are so important for energy production and for brain speed. So many people come to me to say, I'm so tired. I've got such brain fog. And so I check them for that mutation. And so many have at least the minor mutation. And the ones that are real tired with a lot of brain fog and memory problems have the major mutation.
I know. I just started taking this like 2 days ago. So I did. Well, you tested me. I didn't know that I needed it.
Oh, yeah.
And well, I should have known. You probably.
I knew.
What I find and this is what I do every morning, I take 2 of my Brain Zone Basic, which has all the active forms of the B vitamins and trimethylglycine and curcumin that I call the brain trash collector. It takes the beta amyloid out of the brain, along with NAD, which is nicotinamide riboside, which helps to energize the brain and every organ in the body. I take 2 scoops of this. Most of my smaller patients like Meredith only need 1 scoop, but I take it twice a day.
I think she took 2 this morning.
So it supercharges your brain and body, and I love it.
I just took it for 3
Good for you.
days.
You feel
I did
good,
my
don't you?
training, and
Wow,
my
good.
brain was on.
Oh, wow.
Seven
Isn't that
hours.
exciting?
That's very exciting. By the way, Meredith, she's a licensed professional counselor.
Yeah.
That's right.
And she treats children and adults, and she does trauma therapy, which is wonderful. And so I'm going to be referring most of my trauma patients over to her.
Send them to me.
And she loves it. She loves it.
Yeah, I did. I did a little treatment last night.
I was so
Technically did, yeah.
what I love, Meredith, is I love to see this is something that you have a passion
she
for
does.
now. And that passion will really make you just so anointed, is when the passion's there, the anointing's there.
Funny thing about it is I've never been extremely interested in health. I just haven't. But she has. She's always loved health.
But she learned kinesiology too, which is
She
great.
read your books before she even met me, and I
What
don't
would
think I
Jesus
read
eat?
your
What
first.
Oh, Jesus, that was
would Jesus eat?
25, 30 years ago.
16. I got it from my church bookstore.
That's funny.
She read your books before I read your books. And we hadn't even met yet.
Well, that's because you're more like me.
We are with 2 peas in a pod. We like our chocolate.
Chocolate's good for you.
Well, we like our
Dark
milk chocolate.
Ooh, no, that's bad for you.
I know, but I have become a lot more healthy.
Yeah, you have.
Being
Very
close.
much.
So again, we've talked about the major complications in the MTHFR A1298C gene, which is the other. When you're homozygous or you have the major mutation in this gene, listen to the problems that can occur. Number 1, depression, anxiety, mental illness, neural tube defects like spina bifida and miscarriages, as well as brain fog, problems concentrating, especially with the major, and then neuropathy. Neuropathy, which is nerve problems, where you get numbness, tingling, burning pains in your feet or ankles or hands. That's neuropathy. People with this gene, this A1298C, are more prone to nerve pain or neuropathy, where the nerve has been damaged. The nerve's damaged, especially in the lower extremities.
But that's also with diabetes.
Yeah, it can be with diabetes, it can be with low B12. There's many things. This is just one
Right.
of the things we see with this mutation.
And
Or has-
MTHF is just a B vitamin.
Yeah.
People
Well,
need to know that. It's
MTHF is the active form of the B vitamin. It's a methyl tetrahydrofolate, and that forms the enzyme, methyl tetrahydrofolate reductase enzyme, that helps our brain produce energy, our body produce energy. It protects our brain, protects our nervous system, protects our circulation. It's that simple.
It's good.
Real
People
simple.
may think it's a chemical, but
not a
it's
chemical.
just
It's
a
a natural-
methylated form of
Yes.
I have
B
a
vitamin.
question. So if you eat really bad and you have this gene and you just eat really bad and you don't exercise and you take that,
Yeah.
Are you going to feel better?
You will. You will
Well-
feel better. Now, it's not going to be instant. It's not like caffeine. So many people, when they have coffee in 20 minutes, they feel great. But then after about a couple hours, they nosedive and feel bad. This will build up in your system. So the longer you take it, the better you feel. Most of my patients just take 2 in the morning. I personally, since I have the heterozygous minor mutation in the MTHFR C677T gene, I have to take it twice a day. I take 2 in the morning, 2 in the evening. It dropped my homocysteine from 15 down to 7, which is great. As long as your you got to have it below 10. That homocysteine is a bad actor. It can damage your brain, it can damage your blood vessels, and damage your bones, creating plaque in your arteries, plaque in your brain, beta amyloid plaque, leading to memory loss, and bone degeneration, leading to osteoporosis.
All right, so tell the people what's the blood test they need to take.
Well, Mary, I'm not finished.
Well, I know, but I'm telling you, they want to know that.
The blood, okay, all you do is it's a gene test. You want the MTHF gene test.
That's all it is.
That's all it
so
is.
they can tell their doctor that.
Yeah, you can get it from a prescription or you can get it through a buccal smear chromosome test. But that's all you need. It's cheap. It's about $100. Or you can just go online and do it. There's a online test called Life Home Test, which is $99.99. Life Home Test. So again, that's the easiest way to get it. So as far as other issues that this gene causes, I'm talking about the A1298C, it also can cause high platelet counts. Now, the platelets are one of the blood types that's on a CBC. A complete blood count contains the red blood cells, the white blood cells, and the platelets. When your platelets are real high, it causes your blood to clot. So this gene mutation, this other one, the major homozygous mutation, can cause high platelet counts and blood clots. So
now that can cause strokes.
And cause strokes, exactly right.
So people that may have, they're in their 40s and they've had a stroke.
Oh, you got to look for that gene.
You got to look for that gene.
And then sudden hearing loss. I see so many people that come in with sudden hearing loss. Usually I can find it they went out shooting guns or working heavy equipment, or like the lady who used to clean our house, run a vacuum cleaner, a high frequency vacuum cleaner all day long that damaged her high frequency hearing. But in many people that have sudden hearing loss, younger, is from having this gene. When you have this major gene, the A1298C, it can cause it. Now, so again...
Can their hearing loss come back if they take the supplement?
Usually it can't because it's been damaged beyond repair.
And if the two parents have it, because I think of our kids, they listen to loud music, you put those new headphones on, the sound canceling. And
let me tell you what that loud music does. We have these little hair cells in the cochlea, which is the middle part, in the middle ear, and those little hair cells vibrate. When they're exposed to high, loud noise, it causes those hair cells to break. Those hair cells, when they vibrate, they send those vibrations to the brain. The brain interprets it as sound. So the louder the noise, the more those hair cells break. The more that break, the less hearing they'll have, and eventually they can lose their hearing as more break.
And if the mom gets tested, let's say there's a lot of moms that are watching this right now, and they go, I'm getting this test, but I want to buy it for my husband too.
Yeah,
and they both get tested, they both come back negative. There's no way for those kids to have that gene. Is that correct?
Correct.
Okay, so they wouldn't even need to test their...
if they have, I know I have it. Chances are you have it. I don't know if Meredith has it, but the chance... But you probably...
Gift that just keeps on giving. But
I gave you the answer right here. Yeah, at least I gave you the answer. Okay. But now, then there's another mutation that we got to talk on real quick because, we're running out of time. It's the compound mutation. We talked about the bad mutation is the homozygous or the major mutation of the two genes. The MTHFR C677T and the MTHFR A1298C. Those are the majors. But then you have the compound mutation. Now, the major mutation only occurs in about 8.5%. Each one does. The minor mutation of the C677 gene occurs in about 20 to 40%. So as many as 40% have that. That's the one I have. But then you have the compound mutation. You have a minor mutation of the 1298C and a minor mutation of the 677T.
Minors.
And that also is as bad as the major mutation.
Oh, you're kidding.
And that only occurs in 5% of people. But the people who have them usually have major problems. And one lady had this and she had major miscarriages. One lady had major depression. So again, you have to check. And a lot of people say, oh, you just have the minor mutation in the, the 2 MTHFR genes. That's as bad as the major mutation. Most doctors don't know that. Most patients don't know.
Oh, Don, that's important.
It is.
You just said, because for you to say that most doctors miss that because they're really not, this is important.
I just had a lady with bipolar disorder. She was on all these antipsychotic meds that cause all these side effects. And she came in the office and she had been on those for years. And I did her gene test. She had the compound mutation. I said, that's just as bad as a major mutation. So I had to start her on, both the Brain Zone Basic and the MTHFR gene supplement too, both of them. And so now she's doing better. And so I can she's doing so much better now. She's just starting to wean off some of her antipsychotic meds that cause all these side effects.
So to clarify, you can have a major and a major and a minor, which is called a compound?
No, you can have either a major, means you've got a gene from each parent.
Okay.
And the gene, the defective gene, no, that's that's the major, that's the major.
Okay.
And then there's a major on the A1298C, and there's a major on the C677T. That's the bad gene. That's the real bad.
Okay.
Then you can have a minor MTHFR A1298C and a minor on the MTHFR C677T, and that is as bad as the major gene.
But can you have a minor and a major?
No, you can't.
Okay, so it's major or minor, but you can't have minor major.
Most people, you either have minor or major, but there's rare, only 5% of people, 5% have the minor. That's a real rare one.
Okay, and
but that's just as bad.
None.
But it's as bad as major.
Gotcha. You got minor.
No, you're missing.
Okay,
you have a chromosome.
You have to go back.
Go back to program 1.
Okay.
Every one of us has 46 chromosomes. 23 from mom, 23 from dad. Now, it just so happens on this one chromosome, the first chromosome, if you have a major mutation, you have inherited one gene from either mom or dad, or one gene from mom, say, that's mutated.
And it could be a major or minor.
Yeah, you get one gene from mom that's mutated, just mutated.
Okay.
It's not major. And then you have one gene from dad that's normal. That's a minor mutation.
Mm-hmm.
And then, so that's what the minor mutation. Then when you have a major mutation, you get one gene from mom that's mutated. In other words, if you have the C677T, the cytosine, which is the C, that's the base nucleotide, it should have been C. It was a thymine instead. So it's a mutation. You carry that mutation you have a major mutation. You got it from mom and from dad. That's a major mutation. See?
Okay.
Okay, let me ask you this, since it is so confusing.
Just make it minor and major.
Next time we're going to bring pictures. Pictures work.
Will the doctors understand this?
They will.
They'll be able to help people.
All you have to do is remember, minor mutation is not a big deal. All they need is Brain Zone Basic usually.
And the doctor will be able to say to them, you have a minor, or
heterozygous. You may have to remember the term heterozygous. That means minor mutation.
Okay.
Homozygous means major mutation. That's when you're in trouble. Then there's a third category, compound variant, which is a combination of 2 minors, which is as bad as the major.
You're still in trouble.
Well, the homozygous, you're still in trouble.
Okay.
Okay, so I know it gets a little confused. But
listen, we need your help. We want you, if you've enjoyed what we're teaching, we want you to be able to share this. Please, would you share this with your friends and your family? We can't reach everybody, but through you, we can.
Yes.
And if you will share this information, we are about trying to get information to the people. So please share these videos with your friends and your family, because that's a ministry in itself. You may feel like, yes, you know people that this could benefit. So I really want to encourage you. Please share this program.
Well, Dad, that wraps it up for the second episode. Now, next episode, what are we talking about? Let's let the people understand.
Seed oils.
Seed oils. So we are moving on from MTHF, and we're going to be talking about inflammatory seed oils.
Yes.
Now, if you want to get the Brain Zone Basic or Dr. Colbert's Healthy Brain Zone book, which has a lot of great information on how to protect your brain. Go to divinehealth.com. You can pick that information up there, as well as the NAD powder, which is the nicotinamide riboside, the energy for the brain. Dad,
And for the body, I'll say.
well, we love you. Thank you. Thank you, Dad. Mom, Meredith, we will see you in the next episode.